The doctor is in. We are approaching National Sleep Awareness Week, and joining us with a look at hidden causes of insomnia and how to treat it is Dr. Sheetal DeCaria, an anesthesiologist and pain physician who is the author of Break the Chronic Pain Cycle. Welcome to Bloom, doctor.
Thank you. How are you?
Fantastic. So, doctor, what health issues does chronic sleep deprivation cause?
We see a number of chronic disease associated with sleep deprivation. Things from coronary artery disease, Alzheimer's disease, heart disease, type 2 diabetes, obesity, and even chronic pain. We see increased pain sensitivity in people who are not getting an adequate 7 to 9 hours of recommended sleep at night.
So other than that, I understand that there are 5 hidden causes of insomnia and tips to treat it.
Correct. Yes. And the first one that I want to chat about is that glass of wine. Now, many people think that that nightcap actually helps them sleep and sleep well. And although alcohol is a sedative and it will make you sleepy, the fact of the matter is that the type of sleep you're getting throughout the night when you've had alcohol in your system is not quality restorative sleep. And you actually have disturbed sleep cycles. So when you wake up, you typically feel more exhausted. So what I recommend is try to replace that alcohol at night with maybe some chamomile or lavender tea.
That's a good one. What other things can we do to get a good night's sleep? Because you're right, a lot of us do get a little nip of maybe some wine or something else, and you fall asleep fast, but you don't stay asleep.
Correct. Another thing to look at is your list of medications. Now, many very common medications actually have insomnia as a side effect. Some of those being blood pressure medications, steroid medications, or even some of the antidepressants. So if you think that you may be having some insomnia tied to your medicine, take a look at the side effects for that drug. And if it's listed as one, have a conversation with your doctor. Sometimes just changing the time that you take the medicine helps you sleep better.
That's a really interesting one because a lot of people don't research the side effects of their medications. What else should we think about?
The third thing to think about is undiagnosed sleep apnea. Now, a lot of people have sleep apnea and don't even know it. So if you snore loudly, maybe you feel really exhausted during the day, there's a number of risk factors to look for. There's a questionnaire called the Stop Bang It questionnaire. You can find it online. You can find it on my website as well, on my blog. And you can take that questionnaire, and if you meet the risk factors, have a talk with your doctor to get a sleep study, because if you're not treating sleep apnea, that can lead to a lot of those health issues I discussed earlier as well.
Very interesting. And a lot of people don't get the sleep tests or talk to their doctors. They just snore their life away. What else?
Right. Another thing that also happens is that we tend to snack late or eat late meals, and that can affect your sleep also. So not just what you're eating, but when you're eating. If you do eat a big meal and if you suffer from heartburn, for example, you may have difficulty sleeping. Also, things like chocolate, which is a common late night snack, has caffeine in it. But anytime you have any sort of heavy meal late at night, your body's going to be working to digest that meal at night instead of restoring itself. That's going to also lead to disrupted sleep cycles and not a really great night's sleep. So kind of the sweet spot is about 3 hours. Try not to eat any food within 3 hours of bedtime.
Good to know. And what's the final tip, the 5th one?
Sure. The final tip is daylight. So a lot of us know, okay, at night we got to avoid the blue light and the screens, but part of regulating that circadian rhythm and that sleep-wake cycle is actually getting enough daylight during the morning hours. So try to take a walk outside for 15 minutes, get the sun, and have that exposure. If you don't have an opportunity to go outside, you can also use one of these light boxes. They're relatively inexpensive. This one's about $25 on Amazon. You can just turn that on for about 15 minutes in the morning and get that light that way as well, and then you're going to sleep better at night.
You know, I want to ask you one quick question. We have 1 minute left. I noticed you mentioned chocolate, but I had heard somewhere like don't eat pizza or something with tomato sauce because that could start agitating your stomach.
Yes, that's one of the triggering foods for heartburn. So a lot of the acid-causing foods are going to trigger heartburn even in people that don't suffer significant heartburn by producing more acid in the stomach. Then when you lay flat, you're going to have the risk of that actually coming up into your esophagus, which is the tube between your mouth and your stomach, and cause really difficulty sleeping.
So, doctor, where should we go to get all this information? Because this is super valuable.
Sure. It's revitalizemed.com. That's my website. And under the blog, there's a whole article on sleep with tips, as well as that quiz that I talked about earlier.
All right. I'm anxious to take that quiz. That sounds really interesting because I don't think that I get the sleep I need. I know I don't. So we really appreciate you joining us on Bloom today.
You're welcome. Thank you.
And again, I just want to repeat that website for you. It's revitalizemedcenter.com, and we'll be back with more Bloom right after this.